10 early warning signs of cancer you need to know. Unexpected weight loss should never be taken for granted and should never be ignored as a worrying symptom. While slight fluctuations are expected in body weight fluctuations, an unexplained decrease of 10 pounds or more might signal something more concerning, including cancer. Cancer cells can alter how your body uses energy. Their abnormal metabolism consumes significant quantities, leading to unintended weight loss despite no changes being made in diet or physical exercise routine. If persistent weight loss persists without apparent explanation, it should not be ignored as cancer could be to blame. Unexpected weight loss can be particularly concerning if it happens rapidly without any explanation, like dieting or physical activity increases. If this happens to you, seek professional medical help immediately for a proper evaluation and consultation. Your doctor will conduct a physical examination and may order further diagnostic tests in order to pinpoint the source of unexplained weight loss. Cancer could be one possible culprit, but other conditions including thyroid disorders, digestive tract issues, or infections could also play a part in unexplained weight loss. Note that weight loss does not indicate cancer. Rather, it acts as an early warning signal and should prompt further investigations to ascertain potential health concerns. Early diagnosis plays an essential part in successful cancer treatment, so any unexplained weight loss must be addressed promptly to maximize survival rates. Persistent fatigue, defined by feelings of exhaustion and lack of energy, should be taken seriously as a symptom that demands our consideration. While fatigue is a common ailment in modern lifestyles, persistent and unexplained fatigue that doesn't respond to rest or sleep could indicate an underlying health problem, including cancerous cells invading one or both organ systems. Cancerous tumors have the ability to disrupt normal bodily processes and wreak havoc with energy levels, often leaving victims exhausted and feeling powerless against this illness. Cancer cells release substances which interfere with red blood cell production or cause anemia, or may trigger your immune system into responding with antibodies against cancer, leading to feelings of tiredness. Distinguish between normal tiredness from busy schedules or lack of rest and persistent fatigue that remains for an extended period without apparent cause. If unexplained prolonged fatigue becomes evident, medical advice must be sought immediately. Healthcare professionals will evaluate your symptoms, inquire into your medical history, and conduct a physical examination to identify any underlying health conditions, such as cancer. However, fatigue could also be due to stress, depression, or hormonal imbalance. As soon as any unusual lumps or swellings emerge in your body, they should always be considered cause for alarm. Even though not all lumps may be cancerous, any changes could be monitored closely as this could signal cancerous development and seek medical advice immediately to rule out potential issues. Lumps or swellings may appear anywhere on your body, such as breasts, testicles, lymph nodes, neck, or abdomen. While they may not cause pain when present, their existence should always be taken seriously. Though many lumps turn out to be non-cancerous, benign, it is still prudent to visit a healthcare provider for evaluation. A healthcare professional will assess all characteristics related to your lump, including size, shape, consistency, mobility, symptoms. Remember, not all lumps are cancerous. There could be other potential causes, including cysts, infections, or inflammations. Monitoring changes or appearances of new moles on your skin is a key aspect of skin health. Moles, known as nevi, are relatively harmless. However, changes could signal skin cancer warning signs, so it's essential that we remain aware and take necessary precautions. Keep an eye out for any changes in the size, color, shape, or texture of moles when reviewing them for skin cancer risk. Moles that grow larger over time, change shape unexpectedly, or develop irregular borders should also be examined closely, as this could indicate cancerous development. Moles which become itchy or painful without obvious cause should also be assessed by a healthcare professional immediately. Regular self-examinations play an essential part in early detection. Take careful note of where, how big, how often, and any changes that take place with existing moles. Take note of any new mole growth that appears or possible worrisome developments with current ones, so as to detect any disturbing modifications more readily. Professional dermatological evaluations can play an invaluable role in early detection. Dermatologists specialize in skin analysis and can quickly identify abnormal moles or any skin anomalies using tools like dermoscopy. Once again, remember that not all changes to moles indicate cancer. Sometimes harmless factors like hormonal fluctuations, injury, or inflammation cause temporary changes that should not be ignored. Persistent pain that does not go away through normal healing processes should not be ignored, as it could be an indicator of cancer. While pain has many causes, chronic and unexplained discomfort warrants further examination so as to determine its source, which may include various forms of cancer. Cancer pain comes in various forms and locations within the body. Headaches that persist despite standard treatments such as over-the-counter pain relievers may require medical evaluation, while bone pain characterized by deep or dull ache may indicate certain cancers have spread to bones. Backache that worsens at night or doesn't respond to rest or traditional remedies could also be an early indicator. Abdominal pain that persists for any length of time or exhibits other concerning signs should also be evaluated by healthcare professionals immediately. Persistent pain does not always indicate cancer, therefore it should not be neglected. Other conditions, including chronic inflammation, infections, or injuries, could contribute to ongoing discomfort. To properly identify its source and devise treatment solutions, it is crucial that one consult a healthcare provider. Substantial difficulty swallowing or chronic indigestion should never be ignored, as these symptoms may be symptoms of cancer, such as esophageal, stomach, or throat cancers. If these issues don't improve with lifestyle modifications or over-the-counter remedies, consulting a healthcare professional for further examination should be prioritized immediately. Although these symptoms could be due to other health conditions such as gastroesophageal reflux disease, GERD, or peptic ulcers, persistent difficulty swallowing, or chronic indigestion that does not respond to lifestyle adjustments or over-the-counter remedies should warrant medical intervention. A healthcare professional will conduct an in-depth evaluation that may involve physical examination, medical history review, and even further diagnostic tests such as endoscopy or imaging scans as necessary. Changes to bowel or bladder habits shouldn't be taken lightly, particularly if they persist over an extended period. Any sudden shifts in frequency, consistency, color, or presence of blood in bowel movements or urine should be evaluated by medical professionals, as it could indicate cancerous growth such as colorectal, bladder, or prostate cancer. As it pertains to your bowel habits, be wary of changes in frequency or consistency, such as persistent diarrhea or constipation that lasts several weeks without clear cause, along with frequent loose stool or narrow or pencil-thin ones that seem out of place. Also, keep an eye out for visible blood or an increase in visible or undetectable fecal occult blood tests in stool as indicators that further medical examination might be required. Not to be taken lightly are changes to bladder habits. If you notice increased frequency or urgency for urination, difficulty initiating or stopping, pain during or discomfort after urinating or blood in the urine, hematuria, then consulting with healthcare providers for evaluation should not be neglected. Coughing or hoarseness that persists over an extended period should never be ignored, as they could be telling signs of serious health conditions, including lung or throat cancer. Therefore, further investigations need to take place in order to ascertain their causes and offer suitable remedies. Persistent coughs typically last 3 weeks or longer without being caused by an identifiable factor such as colds or respiratory infections, making the condition unresponsive to medical treatments or preventatives such as antibiotics. While prolonged coughs have different causes, one key consideration for any persistent cough should be its potential connection with lung or throat cancer. Coughing up blood, known as hematopeus, requires immediate medical intervention and requires close observation by medical personnel. Just as persistent coughing may indicate potential trouble, prolonged hoarseness or change to voice quality for weeks are warning signs that may indicate potential trouble. Hoarseness refers to abnormal changes in voice quality characterized by rough, raspy, or strained qualities and is caused by irritation of vocal cords, and therefore possible cancer of throat that leads to these voice modifications. If you find that you are experiencing persistent coughing accompanied by blood or have endured hoarseness of voice that changes do not improve with time, seeking medical assistance immediately should be your goal. Unusual bleeding in different parts of your body should never be ignored, as it could indicate various forms of cancer. Rectal, urinary, or vaginal bleeding need immediate medical evaluation in order to accurately diagnose its source and treat accordingly. Rectal bleeding, typically evident as blood in stool or on toilet paper, could be an indicator of colorectal cancer. While there are less serious symptoms, such as hemorrhoids, may also contribute to rectal bleeding symptoms, it's still vitally important that it's assessed to eliminate any possible concerns and rule them out as quickly as possible. Blood in your cough could be an indicator of lung cancer or another respiratory condition. Mammography allows healthcare professionals to detect anomalies before physical examination reveals them. Early intervention and improved treatment outcome results.